Hello, my name is Laurence Sessou. I am a massage therapist working at Waterloo Body Station in London. Today I'm going to be showing you how to make a couple of neuromuscular therapy techniques. We're going to be doing myofascial release on the neck, seated, and then we're going to do a trigger point release. Center your body so we can start doing the myofascial on your neck. Okay, so I'm going to have your feet just here aligned with your hip. That's great. You can relax your arms on the side. I'm going to have you sitting up. So I'm going to apply a bit of pressure here. You're going to resist me slightly. That's great. Don't forget to breathe. I'm going to do the same on this side here. Wonderful. And we'll do a last one on the back. That's great. Rotate your head on both sides. And you're going to tell me which side is feeling a bit more restricted.
From the outside.
Yeah? Okay, so that's the side we're going to be doing the facial work. What I'm going to ask you to do is to bend your head towards me, and then you're going to move down and move away from me. You want to feel a stretch into your neck. Okay? And the movement will be quite slow. So I'm going to be using my body weight. And using my forearm, I'm going to support her back, and with my forearm, I'm just gently lean. So now you can bend your head towards me, and then down. That's great. We're going to do it again. Trying to have a slower movement. That's very good.
Yes, there is, yeah.
It is?
Yeah.
Okay. And now what I'm going to do is go on to the trigger point release. A trigger point is basically a note band formed into the muscle fibers. And what happens when this note is formed, it causes pain. So if you have like a nose that's been here for ages, it's very possible that it's a trigger point. You can also sense a trigger point when you palpate the skin by change of temperature. If it's a bit warmer or if it feels a bit moist, there's a possibility that there's a trigger point there. So that's how you find them. Also, when you feel a knot and the client sometimes is kind of jumping, that's a possible trigger point too. Okay? We can stop applying the pressure. We need to stretch the area. So there's two different stretch we can do. There's a C stretch, which is looking like a C, which is not very easy in this area. And then we've got the S stretch, which is looking like an S. And that's just to give the muscle fibers their flow again and giving back their shape. And also allowing the nutrition and the blood to flow freely and nicely. What I've done with our model here, because her neck was a bit restricted, the range of movement wasn't flowing, and I found a knot in there. That's why I chose to do the myofascial release and then the trigger point release. And that's how I would demonstrate some techniques of neuromuscular therapy.